Hello, everyone. Thank you for joining in for another episode of Cancer Talk with Dignite. As you all know, the purpose of organizing this series is to ensure that we provide practical and useful information to newly diagnosed cancer patients and also their caregivers. Today, we have Dr. Abhishek Gulia joining us for the session. To give you a brief introduction, Dr. Abhishek is a senior consultant radiation oncologist currently working with JP Hospital in Noida. He has over 12 years of experience working with cancer patients across different domains. And today he will walk us through all the basics and the useful and critical information pertaining to radiation therapy for cervical cancer patients. With that, Doctor, I welcome you to this session. Thank you so much for joining us.
Thank you, Dignite Cancer Care, for providing me this opportunity to help in spread of awareness about the treatment and the disease cervical cancer as it is. And at the outset, I would like to say cervical cancer affects around 1.25 lakh women in our country every year. And it's very unfortunate that around half of them succumb to this disease. And now various factors are there why it happens so, and despite having a very effective treatment in the form of radiation for cervical cancer, we still are unable to to take the cure rates at a higher level. Various factors are there. Patients present late to us. Patients are not aware sometimes, and sometimes they're not aware. What is the best modality they can approach and they can go for? So I help this talk helps in spreading awareness and helps in increasing that number of cured patients in our country. Yeah, we
Okay.
should start.
Thank you. Thank you for setting the tone for this session, Doctor. So, the first question is something that is pertaining to every woman in this country, which is what are the risk factors associated with cervical cancer, and how does one know whether they are at risk or no?
So, as far as the risk factors of having cervical cancer is concerned, one is it is more commonly seen in patients who are multiparous, that is, having more kids, like 7 or more kids. Nowadays, it's very uncommon, especially in the urban population. Then, multiple partners. If a lady has multiple partners, then the risk of having cervical cancer goes high. Then, the smoking, alcohol, they also contribute to it. Then low socioeconomic conditions like unhygienic conditions, they promote infections, sexually transmitted diseases, and especially the infections with human papillomavirus, which is also a sexually transmitted virus. If that is acquired by a lady, then that is very incriminative. That is a causative agent in the development of cervical cancer.
Okay, okay, okay. And so, in terms of the screening for cervical cancer, because you did mention in the intro that most of the ladies present late at a later stage, what sort of screening is done for cervical cancer, and when should a woman approach for such screening?
So the screening of cervical cancer patients can be done at the primary health center also. It can be done by a gynecologist or can be done by an oncologist. There is a very simple test by the name called pap smear, which is
Okay.
an OPD procedure. You don't have to get admitted for that. It's a very short procedure, like hardly takes around 10 minutes. And the patient has to just come to the doctor. And all ladies who are more than 25 to 30 years of age, like if they are more than 25, they can start. And every 3 years, they should get tested. There should be a pap smear which should be done. And if the pap is negative, then after 3 consecutive negative paps, we can further increase the duration, like to 5 years or so. Then after every 5 years, the patient has to undergo a pap smear. And if everything is going on fine, they can continue as it is, continue the screening. And this routine of pap smear every 3 years or 5 years has to be done until the patient is 65 years of age.
Okay, okay. I think that is fairly self-explanatory, which is every 3 years they need to undergo a pap smear. And if I may ask you about the rough cost estimate of undergoing a pap smear test?
It's virtually free of cost in the government hospitals or the primary health centers. And if
Okay.
you go for any private hospital also, they'll be charging less than say 1,000 for that.
Okay, okay. I think that's good
Completely.
information to have. Okay. So in terms of the now moving on to the treatment side, there are various modalities of treatments, which is chemotherapy, surgery, radiation, and so on, right? Before we get into radiation as a treatment option, could you broadly explain what are the types of treatment available for a cervical cancer patient?
If I say for any cancer treatment, any cancer patient, there are mainly three types of treatment which is available. One is the surgery. The patient can be told or can best be treated by a surgical oncologist by surgery, or chemotherapy or radiation therapy. So these are the three basic modalities which patient can be which patient can be offered.
Okay.
And now there are various combination and various sequences and the ways in which all these modalities can be used. So these three modalities are not antagonistic to each other. They are not very competitive to each other. They are very complementary to each other.
Okay.
In most of the patients, I'm not talking about cervical cancer per se, but in most of the patients of cancer, in any cancer, we in early stages only a single modality usually suffices. But in later stages, we have to combine two or more modalities
Okay.
as per the advanced stage of the disease. We have to use a lot of armamentarium, what we have, in order to control, in order to try to control that disease.
Okay.
Now coming to cervical cancer.
Okay.
In society and as a as a member of the society, as a part of the society, everybody feels that the best way to treat any tumor or any lesion is to just cut it and throw it away.
Yeah.
Everybody thinks surgery is the, and it's like the common sense and the mindset is like surgery is the treatment for any tumor, any lesion, any growth in the body. But unfortunately or fortunately, this is not good. This does not hold good for the cervical cancer case. In cervical cancer, it has been found that radiation therapy is the best modality which is available for treatment of cervical cancer. It is not that people have not tried surgery. They have tried surgery, they have compared radiation and surgery. And after a lot of trials, after a lot of studies, it has been found that the best treatment which can be done, which can be offered for cervical cancer patients is radiation therapy. Having said that, I must say, cervical cancer, just like any other cancer, has a lot of stages. Broadly, if I say, it has 4 stages. So in 4 stages, surgery and radiation are of give equivalent results unless and until the tumor is like less than 4 centimeter. So if the tumor is less than 4 centimeter, the patient can be treated by a surgical oncologist also, by a surgery also.
Okay.
But if the patient has a tumor which is more than 4 centimeters, or if the patient has lymph nodes, a tumor which has spread in the abdomen into the lymph nodes,
Mm.
then the primary modality of treatment becomes radiation therapy. Also, in the early stages also, even if the patient has the tumor less than 4 centimeter, radiation therapy and surgery both are equal in the outcomes.
Okay. Okay.
And as far as the role of chemotherapy is concerned in treatment of cervical cancer, chemotherapy is also used, but only in very low doses just to enhance the effect of radiation. And it is used in radiosensitizing doses in the treatment of cervical cancer. So
Okay.
chemotherapy by itself is not used alone as far as cervical cancer is concerned, but it is always used in combination of radiation therapy and just to enhance the effect of radiation therapy by around 6 to 8%.
Okay. 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 So, if
Also, I would like to mention here
yeah.
that radiation therapy, when we use radiation therapy for cervical cancer, the radiation therapy has to be given in two parts. One is the external part, which is used along with chemotherapy. Some little doses of chemotherapy are given. And after that, a very specific and very high dose of radiation is given by the internal radiation, which is
Okay.
very painless and very, very safe.
Okay.
And this is known as brachytherapy. So it can be broadly divided into external and internal radiation.
Okay. Okay. Because this was my leading question, to try to explain what radiation means. And so, now that we've already discussed the types of radiation, what are the common side effects pertaining to radiation in cervical cancer?
Okay. So as far as use of radiation is concerned, radiation is an enigma, especially like we associate with radiation with atomic bombings in Hiroshima and
Yeah.
Nagasaki, and radiation accidents, and everybody is very scared of radiation. When we talk about that you will be you will be given radiation, and somehow they get very scared. Radiation is something which is to be afraid of, but it is not so. uh, with this talk, I would like to emphasize radiation is one of the most safest and the best and most accurate type of treatment which is available for cancer. And as far as radiation is concerned, with the newer techniques, especially radiation as a field has undergone tremendous advancements in the last 2 decades, especially in the last 1 decade, which
Okay.
has reduced the side effects a lot. And if you talk about radiation side effects in cervical cancer, the radiation side effects of in cervical cancer, they uh, in around 90% of the patients they don't have any side effects, but in around 5 to 10% patients, uh, these patients can experience a bit of loss of appetite. They
Okay.
can experience early tiredness, or as I say, easy fatigability,
Okay.
especially in the fag end of treatment, in the last leg of treatment.
Okay.
And they can also develop like some diarrhea or some burning sensation while they pass urine.
Okay.
Having said that, only 5 to 10% patients develop these kind of symptoms, and even if they develop, it's very easily managed, and manageable is very manageable by use of simple medications.
Okay. And so, if now moving on to the lifestyle of cancer patients while undergoing therapy, what is it that they could do to better prepare their body for radiation?
So, what we what mistakes we the patients do usually is, as soon as they are diagnosed with any cancer or any disease, we have a tendency to start doing a lot of exercises. We have a tendency of start eating a lot of fruits. Then we start to follow a very healthy lifestyle, and we make a lot of changes
Yeah.
at that time as soon as we are diagnosed with the disease.
Yeah.
But the best way to prepare your body for any kind of cancer treatment, specifically radiation therapy in cervical cancer, is
Mm.
not to indulge in anything extra which you were not doing since long. Like
Okay.
if you are not doing yoga or if you are not doing exercises, you should not start it now.
Okay.
And if you were doing it since a long time, it was your routine, then you should continue to follow your routine. Okay, because the body will not be able to tolerate those adjustments at this point of time.
Okay.
Specifically for cervical cancer patients who are going for radiation therapy, there are 2 to 3 things which they should keep in mind. First is they should avoid taking milk, because
Okay.
sometimes in some patients, milk is not very well tolerated when radiation is delivered to abdomen region, or the pelvis region rather.
Okay.
These these patients also should not take a lot of citrus juices, which
Okay.
also gives a lot of acidity and bloating sensation.
Okay.
Also, they should take around 2 to 3 liters of water daily.
Okay.
Now, this solves 2 purposes. One is they pass a lot of urine. So, the burning sensation in urine, which is a probable side effect, the chances of that are reduced. The second thing is, the more important thing is, they don't have constipation, because if somebody drinks around 2 to 3 liters of water, they won't have constipation.
Okay.
And we need to strictly avoid constipation in cervical cancer patients who either are receiving radiations, or who have received radiation therapy for this disease in past also.
Okay. 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 So, in terms of, so I will quickly repeat the probable side effects that you had mentioned. You mentioned that very few people, which is maybe probably 8 to 10% of them, might experience side effects, which includes loss of appetite, fatigue, diarrhea, and burning sensation while urination, right? And these are also these are also reversible. All of them are reversible as and when the treatment is done. And more importantly, this could be easily managed by the medication that is currently available, right? Okay, I think that's a fair point. So in terms of a caretaker's responsibility, because usually when it comes to all the research work and understanding the treatment, the modalities and everything, it's the caretaker who needs to be well versed with all this. So what are the tips that you have for caretakers in this particular context?
Okay, so caretakers should not be taking extra care of the patient.
Okay.
By this, I mean they should not be making the patient all the time aware that she is having cancer. because that leaves a lot of that doesn't boost the morale, that brings the morale down of the patient, and the patient goes into slight kind of depression if somebody makes her aware that she is having cancer. And it's not the job of caretaker to tell the patient that she should be resting always, she should be at home, because cancer patients, or specifically cervical cancer patients, I don't advise them to stay at home, or they should not be lying down. They should be just following their routine activities, as I told earlier. If they are working in a bank, if the lady is working in a school, they don't need to take a leave from the bank. They don't need to interrupt their working habits, their working culture in any way. And trust me, with the advancements and the advanced techniques in radiation which we have nowadays, they'll be able to fulfill all their daily routine and daily duties while they are receiving radiation therapy. As far as radiation is concerned, they'd have to just take out 1 hour from their daily life to receive radiation. And after that, uh, all the patients which I have, which are working ladies, they continue to follow their routine lifestyle and they're working. So as far as cervical cancer is concerned, the caretakers and the patient herself, they don't need to make any lifestyle changes in their life. They can continue with their routine working. They should,
Okay.
although I must stress, they should maintain a healthy lifestyle,
Okay.
but not much is needed from the caretaker side. No.
Okay. So the next question that I have is more so directed to younger women who get diagnosed with cervical cancer, in terms of the future prospects, like, as to how their life would get impacted or their child rearing ability. So how does one go about understanding how it impacts them? Right. Based on your experience, could you please shed some light on this issue, please?
Yeah. Nowadays, unfortunately, we have more and more ladies who are diagnosed with cervical cancer at a younger age. And unfortunately, it has a lot of impact on the life of that lady. First is, I'll divide it into 2 or 3 parts. First is the childbearing ability.
Yeah.
Now, when the cervical cancer, which is nothing but a cancer of the lowermost part of the uterus, which we treat, then inadvertently we deliver very high doses to the ovaries also. Ovaries are the female glands which produce ovum.
Yeah.
So now when we give radiation to that part, then the childbearing ability, there is a very, very high chance that the patient will not be able to have children
Okay.
after receiving radiation therapy. So if some lady has an issue, and if she wants in future to beget children, if she wants to have children, then always this should be discussed beforehand with the treating doctor. And it's the duty of the doctor also to let the patient decide and explain and discuss the situation. The A very important thing, we have options. It's not that we all everything is very doom and gloom. We can harvest the ovum, we can do ovum preservation, we can do oocyte preservation, and then the patient in future can use those ova with the help of some surrogate or other methods. There are a variety of methods which can be done, but
Okay.
this issue should be discussed beforehand.
Okay. Okay.
Okay, so childbearing ability does get compromised after radiation is received by a patient, and oocyte preservation should be considered before radiation is initiated.
Okay.
This is the first point.
Okay.
The second issue is, in these patients, when we give radiation to the pelvis region and ovaries also are impacted, then apart from childbearing, the second thing which gets impacted is the hormone production by the ovary. Ovaries are the main sites of production of estrogen in a female.
Okay.
Now, at the age of menopause, say at around 50 years of age, when the females usually attain menopause, they have a lot of problems because of these kind of hormone withdrawal. We call it a hormone withdrawal syndrome. And these problems include some cardiovascular side effects. The bones start getting weak. There are issues in the behavioral changes. They are sometimes very depressive, sometimes where they are very anxious, they are aggressive. So they have mood swings. When we give radiation to ovaries, the hormone production also is decreased, and these patients can develop these menopausal symptoms at an earlier age.
Okay.
And obviously, the third thing is cessation of the menstrual function. 99% of the patients after treatment of CA cervix by radiation, it's a very, very high chance that menstrual function will cease. after such high doses of radiation, which we have to deliver in these kind of cases.
Okay, okay. So, in terms of the treatment rates, in terms of the cure, right? So, what percentage of patients are likely to get cured and completely get rid of the cancer?
So if I combine all the stages of cervical cancer,
Mhm.
and if I give one cure rate, it is 66%. That is, out of three, every two patients get completely cured when they receive a proper treatment.
Okay.
Now, this is a very vague kind of a figure. If we have to divide it to be more specific, we have to see stage wise.
Okay.
Cervical cancer is broadly in it has four stages. In the stage one, in first stage, the cure rates are so high, they are like 90 to 95%.
Mhm.
So if 100 patients come to me and those 100 patients have stage 1 cervical cancer and I give treatment, out of those 100, 90 to 95 ladies will be completely cured. Now if they come to me, if 100 ladies come to me with stage 2 cervical cancer, then the cure rates fall to 80 to 70%. In stage 3, the cure rates are like 50%. Out of those 100 ladies which come with a stage 3 cancer, only around 50 will get completely cured. And if 100 ladies come to me with stage 4 cervical cancer, the chance of complete cure will be around 20 to 30%.
Okay.
So it's pretty stage dependent. So that's why we say the earlier you come to the doctor, the higher is the chance of getting completely cured. And it makes a lot of difference. Like if you have a 95% chance of getting completely cured compared to if you have a 15 to 20% chance, now that makes a hell lot of difference.
True, true. And bringing up the first point that you mentioned around pap smear test, which could be a regular 3-year period thing, this could play a vital role in ensuring that patients can come to you earlier.
Yeah, because earlier I at the start of this talk, I told that the cure rates in India are not very encouraging, like 50%. If we have 1.25 lakh ladies who are diagnosed yearly with this disease, half of them die. Now, a lot of factors play this role. And the most important factor is they don't come to the doctor early.
Okay.
If these patients come early, like if these patients come in stage 1 or 2, these we would be able to save around 1.1 lakh patients out of 1.2. So the cure rate would be very, very high. So this
True.
is the main difference between India and the other advanced countries like European countries or US, that the cure rates are so different in cervical cancer because
Yeah.
we don't come early. And pap smear would play a very, very, very important role. And we have and your organization and me as a cancer doctor and every individual in the society, whosoever thinks they need to give something back to the society, we have a responsibility that we spread awareness about these pap smear tests. That nothing, it's not a big deal. Like going once to the doctor for a 5 minutes procedure in 3 years is not a big deal.
True.
But how many of the ladies do it? I am not aware of many. I am not aware of many, unfortunately.
Yeah. Yeah. And so this leads to my next question, which is, out of all the women who get cured of cancer, there is always a fear of recurrence. Right? So how could one assess the risk of recurrence, and how could they also prepare themselves to avoid recurrence? So what is your take on that?
So suppose a lady comes and we treat and she is declared disease free.
Yeah.
All right. And there is always a chance, as you say rightly, that the disease can come back. This chance of disease coming back, or the recurrence as we say in more scientific language, is highest in the first 2 years.
Okay.
That is why when we call the patient for follow-up visits, we call it the follow-up visit. Now after treatment, we are following it up, how the patient is responding, and if there is any unfortunate uh, recurrence.
Yeah.
The highest risk is in the first 2 years. In these 2 years, that is why most of the oncologists or the cancer specialists, they call patients more frequently. They call them once in every 2 months.
Okay.
Then, as the time increases, they call them once in every 3 years. Then, in the third year of treatment, after 3 years of treatment, they'll be calling them like 4 months,
Hmm.
once in every 4 months. and then 6 months thereafter. What is to be done in these visits is what most of us don't realize. The most important thing is clinical examination by the doctor. Everybody thinks that we should go for MRIs, we should go for PET scan, a CT scan, but in cervical cancer, the most important thing which is to be done by a doctor on these follow-up visits to check for any recurrence is cervical examination, the per vaginal or the per speculum examination, clinical examination by the doctor.
Okay.
If the doctor feels something is amiss, then he can then he can further evaluate with scans, or we have a plethora of scans to evaluate if a doctor has some kind of doubt.
Okay.
But the most important thing I like to stress is clinical examination by the doctor. In the first year, every 2 months, it should be done.
Okay. Okay. Fair point. And so this brings me to my last question, which is for any patient or caregivers who are currently watching this video, what are the kind of tips or basic things that you would want them to keep in mind when they're going for treatment?
The most important tip, which I have already given in this video, is avoid constipation.
Okay.
It makes a whole lot of difference. Not only in the time of radiation, not only during the radiation, but throughout life. Because I have seen some patients who were treated who were treated by the previous older techniques, which were not very refined at that time. Patients who were treated around 40 years ago, 30 years ago, they develop a lot of bleeding from the rectum when they pass stool, and the quality of life is impacted by it. So never allow constipation to come into your lifestyle when you have received radiation. This is one tip. The second tip is, if you are receiving radiation, then there's no need of doing a lot of exercises or eating a lot of wheat grass juice or taking a lot of antioxidants and starting yoga, pranayama, all these things at that time. You should never do it, because radiation is a very time duration dependent kind of a treatment. The outcome of radiation is time dependent. That is, when we start radiation, then radiation is to be completed within 8 weeks. If this 8 weeks is exceeded, then the outcomes are not that good. So in order to complete the treatment in 8 weeks, you should not try anything adventurous, and you should not take unnecessary gaps, because as soon as the duration of treatment, right from the starting of radiation till the completion of radiation, if the duration is more than 8 weeks, then for every day, the control rate and the survival rate, the outcome goes on decreasing by 1%. So you should follow what the doctor says. You should adhere to the timelines very, 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 very diligently. If the doctor has called you for a particular session of intra-cavitary radiation or particular session of external radiation, and you have some function in your family function in your home, then you should, unless and until it is very, very important, you should try and make it to the hospital. Make it to the hospital, because 8 weeks is a golden figure which everybody should remember.
Okay. So I think broadly speaking, like you rightly said, which is the patient should take care of their body, should not try anything new and out of the world, which might actually put them in a shock, and be prepared to go through the entire radiation cycle within the stipulated period of time. Right?
Yeah.
And a quick question or clarification on the first point that you raised regarding constipation, because you said there are women who are suffering through life, right, even after treatment. So does that mean that even a couple of years after the radiation is done, they still face these issues, or is it only during that particular phase?
Well, all the side effects of radiation can be broadly divided into two types. Broadly divided into two. One is the side effects during the treatment, which I have discussed in my talk previously. The second set of side effects is the late side effects. Suppose a lady gets cured of the disease, like the case I was talking about. That lady was cured 30 years ago by the disease, from the disease. She is now cancer free. But the late side effects of the treatment are such that she is still enduring the pain of those side effects. So definitely, yes, the patient can have late side effects. And what are these late side effects? There's always a chance of bleeding from the rectum.
Okay.
However, I must clarify, in the last 10 decades, the radiation techniques have undergone tremendous advancements. Nowadays, we have techniques like IMRT, IJRT, or further refinements like VMAT or RapidArc.
Okay.
With IMRT, with the development of IMRT, the technique gave us a tool to save the organs at risk. Organs at risk are the organs which are lying very close to the target area. In the case of cervical cancer, it is urinary bladder in the front and rectum, that is the passage of pathway of stool in the behind. So nowadays, with the latest techniques, we are pretty much able to save all these organs, and the effect of these radiations are like minimal on these organs. But patients who were treated by the previous techniques, by cobalt machines in the older times, they have a very high risk of these late side effects like bleeding from rectum on having constipation.
Okay. Okay. Perfect, doctor. I think with that, we've completed all the questions that we had planned for this session. And so, for everyone watching, if there are any questions or suggestions or feedback that you have pertaining to this, please feel free to drop them in the comments. We will go through them and we will respond to them as well. And with that, doctor, thank you so much for your time. I'm sure that people who are viewing this will find this information extremely useful. And with that, thank you. Thank you for this.
Thank you.
Thank you.